Dr. Oz, my staff and I have enjoyed working with you and your team throughout this committee's rigorous vetting process, and I appreciate your candor and responsiveness. You have provided significant amounts of documentation to substantiate your tax return positions and followed all of the applicable law. You have met the same due diligence standard that has applied to every nominee in every previous administration. And I'll say once again, I believe that the Finance Committee has the most thorough and rigorous vetting process of any committee. You have gone through that vetting process and have proven yourself to be an outstanding nominee worthy of this nomination. I again thank you for your cooperation throughout this exacting process and for conducting yourself with kindness and professionalism. I look forward to continuing our work together. For those outside of Washington, CMS can seem like a bureaucratic black box, largely removed from everyday challenges facing patients and clinicians. Dr. Oz, you offer a wealth of firsthand experience and expertise, having studied, practiced, and taught as an accomplished physician. In short, you understand how DC legalese looks on the ground and how policy plays out in practice. This is exactly the mindset we need for a CMS administrator. From our discussions, you also clearly recognize the importance of this role and the programs that CMS manages, along with the tremendous responsibility that taking the helm of this entails. As the world's largest health insurer, CMS sets healthcare coverage and payment policies for tens of millions of Americans and their providers. Medicare currently enrolls more than 68 million Americans. Medicaid and the Children's Health Insurance Program, or CHIP, comprise close to 80 million. And more than 24 million consumers have selected individual market plans. Over the course of the next 25 years, analysts project the Medicare-aged population will grow by an additional 47%, further underscoring the high stakes of CMS policymaking. Ensuring sustainable and stable and proactive rules of the road for these programs will necessitate a collaborative and constructive approach. Medicare seniors deserve better prescription drug affordability, along with stronger access to pharmacists and doctors. This committee has taken steps to achieve these goals on a broad bipartisan basis, and we look forward to working with you to advance those measures. This includes pharmaceutical benefit manager reform, or PBM reform, a stated priority for President Trump. Your background also offers the ideal experience for guiding efforts to reform our broken clinician payment system, an issue that you understand from both a policy standpoint and a pragmatic perspective. Modernizing federal health care programs will require rethinking our outdated approach to treating the symptoms rather than the underlying causes of chronic disease. Equipping providers with the training to employ a diverse array of interventions, from nutrition and lifestyle changes to cutting-edge drugs and devices, will save lives and taxpayer dollars. Technological advancements like telehealth also offer an opportunity to reshape healthcare delivery in rural communities, including in Idaho, where access to basic services remains challenging. Medicare Advantage's market-driven benefit structure provides seniors with more timely access to these and other novel approaches to care. Its successes should serve as a model for other federal programs. Similarly, Medicaid's essential safety net coverage relies on a balance between state-based flexibilities with key patient protections. Based on our conversations, I'm confident your experience as a physician serving Medicaid beneficiaries will be an asset to CMS. I look forward to learning more about your vision today about how we can work together to strengthen our healthcare system for patients, providers, and taxpayers.